The next thing we're going to look at is the question, do I care about it right now? Okay, so this is when prioritizing labs and really knowing your abnormals versus normals is going to be important. Denise, the nurse cares for a client with renal failure who is scheduled for dialysis this afternoon. Which finding requires immediate attention? So we have a GFR of 15, a BUN of 48, a creatinine of 3.1, and a potassium of 7.2. Are any of the labs normal?
Mm. But which one's going to kill you first, right?
So now that we've gotten that out of the way, none of them are normal. And it's not like they're just a little bit abnormal, so that's important too. For the NCLEX, values that are important won't be a little bit abnormal, right? You're not going to be looking at a potassium of 5.1, right? You're not going to be looking at a GFR of 82. Okay, they're not going to be a little bit normal. They're not like, that's where knowing your abnormals versus your normals actually comes into play. So walk us through each one of those answers.
It'd be real helpful if I remembered the normals.
Okay, so you can also phone a friend. What's normal for a GFR, guys?
Greater than 60. Mm-hmm. Greater than 60.
Greater than 60.
And UN is like, what, 16 to 20?
20.
BUN is somewhere around 16 to 20.
16.
And of course,
And
potassium
then
3.5.
creatinine is like point.
We were taught 6 to 20.
0.6 to 1.
For BUN, well, I did say somewhere. It depends on which lab you're using too. But most folks, their BUN is going to be like 18 if they're good.
So basically their kidneys are crap, but we're worried about their heart because that's a major organ and
Okay.
it can cause dysrhythmias.
So the normal for the creatinine was what?
0.6 to
0.6 to
1.
1.
Yeah, so like 1, right? And then the normal for potassium we established was what?
3.5 to 5.5.
Yeah, 3.5 to 4.5 or 5, something like that.
But they have renal failure.
Yeah,
So
Expected
essentially
GFR
all
to
of
be out
those
of whack already.
renal labs are going to be
Yeah.
out of whack in some way.
yep.
So the thing that alarms you would be potassium
Because of the cardiac.
yeah.
Yep. So literally all of those renal labs are totally normal for this person who has renal failure. The thing that's not normal and we can't leave is the potassium. So that is going to be the one thing that is not getting addressed already, that is not expected, that we do have to address.